So my CV has been a series of many twists and turns, and with every turn, I have learned something new that has enabled me to become the hardworking, skillful, and compassionate doctor that I am today. I started my clinical experience after graduating in 2017 from Aziz Fatma Medical and Dental College, and I have over 4 years of post internship clinical experience. Currently, I'm working in a cardiac specialty tertiary care public hospital, which is a 280 plus bed hospital. I'm working in anesthesia and intensive care unit, and I'm involved with the pre, intra, and post operative management of patients here. Previously, I was working in A&E in a secondary care public hospital for 19 months, and I was attending to acute medical and trauma related cases on a daily basis. I was also deputy to medical superintendent for 7 months in this post of mine. My clinical experience started with the foundation year one post that I held in a 1800 plus bed multi-speciality hospital, and I took rotations in general surgery, orthopedics and trauma, medicine and dermatology there. I do understand the importance of personal and professional development required to be the ideal clinician, and for that purpose, I try to enhance myself with continuous medical education. And I have attended multiple seminars, symposiums, workshops in my department and elsewhere. I'm certified with BLS by AHA and in ACLS by BIM Nevada, and I hope that I will be given the chance to get certified in ATLS while working in the NHS. I've also attended a 1 week course in clinical governance, and I have enrolled myself in a certificate of clinical education for 6 months, and ECG and chest x ray courses of 1 month each. I've also attended multiple webinars on anesthesia, intensive care management, and infection control during the pandemic time because we weren't attending any seminars in person. I've also, as I mentioned, that I have been a deputy medical superintendent, so I have leadership and management experience in a clinical setting. For 7 months, I learned a lot of skills about how to improve as a manager and how to deal with administrative issues. In my leisure time, I enjoy watching docuseries, movies, I play football, I draw comics, and I enjoy music. Why work in the United Kingdom? The contribution this country has made to the medical and surgical field are endless. I mean, if we just talk about the last decade, uh, the first gene therapy in immunocompromised children and the first bionic hand are just reflections of how this country has been a pioneer in innovation. I've also always sought the nice guidelines whenever I came to a standstill, and just the fact that I will be given the chance to work in the country where these guidelines were made makes me content that I'm in the right place. Apart from that, the trust-based healthcare delivery system in NHS and United Kingdom uh, is amazing, and I hope to be a part of this system, and I hope that someday, as a consultant, I will be able to give back to the trusts and the community. The experiences that I bring to this post. So I have developed a very sound understanding of the clinical aspects required for this job post, and having been worked in a specialty-based anesthesia department for over 2 years, I have good knowledge of the basics of anesthesia and the clinical aspects that come with it. I have also acquired many useful procedural skills while working here, and I'm actually quite confident in performing them. Uh, CVP insertion and laryngoscopy and intubation, just to name a few. I've also worked as a leader in a clinical setting for over 7 months, so I have a very good understanding of management and attending to administrative issues as well. So I will be able to help the department with that as well. Since I've been involved in clinical governance projects, it has enabled me to have a very critical eye on the practices that we adapt in patient management, and that also enables me to look for ways to improve these practices and ensure that our patients are safe while we treat them. Also, my interpersonal skills are quite excellent, and that enables me to be a very good counselor, a negotiator, and a confidant that the patients and colleagues can confide in with their matters. Research and audit projects. So I'm currently involved in a research project with a colleague of mine, and I have been part of two clinical governance projects at my current job post. One of these was an interesting one that we concluded in March of 2021. I noticed that there were a lot of complications arising in patients post cardiac surgery when they were mobilized to the toilets. There were falls, collapses, arrhythmias, shortness of breath among other less frequent events. We started looking at the practices that we were adapting regarding these patients. We turned to the local guidelines, if there were any guidelines regarding this issue. We distributed Google Forms among nursing department and doctors in the department. We talked to our head of department about the issues that we had isolated, and we were allowed to make some changes to the system. We introduced a bedside performer where the nurses would mention the vitals before and after going to the toilet. They would also mention any events or any abnormal vitals, and we urge the doctors to attend to these patients and mention any abnormal findings after coming back from the toilets. We also arranged for some helping staff to assist the attendant and the patient when they were going to the toilet, and be ready for any events that might arise. So the results were actually quite amazing because we noticed there was a 60 more than 60% reduction in the occurrence of these incidents after making these changes. So I've enjoyed this project of mine, and I'm quite hopeful that I will be given a chance to continue this interest of mine while working with you as well.